we're going to finish up the skeletal system unit by just going over some terminology. So this is just going to be some quick terms that you need to be familiar with. First off, though, you have heard me talk about this before. The skeleton is actually divided into two separate divisions, and it's going to be what we call the axial and the appendicular skeleton. And the way you can remember that is relatively simple. Axis means central, right? So for example, the Earth's axis is right down the middle of the Earth. Appendicular refers to appendages. So let's go through those real quick now. Axial is going to be your skull, your vertebrae, your sternum, your ribs, which is also going to be what's considered your thorax. And then we have a small bone that sits right here called the hyoid bone. It's the only bone that's actually not attached to another bone. It's held in place by muscle, and it actually is what anchors your tongue. So it sits right here. You can actually feel it. It feels weird. You can move it back and forth, but that's considered part of the axial skeleton. The appendicular skeleton, on the other hand, that is going to be your pectoral girdle, which is going to be made up of your collarbone and your scapula, which is your shoulder blade, your pelvic girdle, which is going to be your pelvic bones. So that would be this right here. This would be your pelvic girdle, your pelvic bones, and then also your limbs, your arms and your legs. We have 206 bones in the human skeleton. It's actually more in infants, and as the baby develops, it becomes less because some bones fuse together. But in an adult human, it's 206 bones. Now, some people do have some extra bones, and they're little tiny sesamoid bones, and they're called sutural bones. And they exist in the cracks between the cranium. So if I have a skull here, there are some cracks, there are some things called sutures that are in the cranium, and you might not be able to see it because of, not the best quality here, but you can see that there's some cracks there, which are called sutures, and that is where the plates of the skull fuse together. Sometimes you get little tiny extra bones in there. They don't function in any way, but technically some people have more than 206. But 206 is the magic number. That's how many bones there are in a human skeleton. So this is just a diagram to show you everything that is this kind of orange color. That is going to be axial. So it's your skull, it's going to be your vertebrae, your ribs, your sternum, and then the hyoid bone is real small. It sits right there. And then your appendicular is going to be your clavicle and scapula. That's the pectoral girdle, the arms, and then the pelvic girdle, which is going to be, these are called your coxal bones. We're going to talk about that later on. And then your legs. So those are going to be your axial versus your appendicular. Now we got to go through some terminology. So basically, bones are not smooth. Bones have lots of different things going on. And the reason why is because bones are hard. And for example, if blood vessels need to get through a bone, they need to go through an opening. We talked about that before. Also, the purpose of bone is for muscle attachment. So there's going to be lots of bumps on bones, and that's for muscles to attach. Think about rock climbing. If you've ever seen rock climbers before, they need to grab onto the handholds to hold on and pull themselves up. Well, when muscle attaches to bone, it's got to pull really hard on that bone. So there needs to be something for that muscle's tendon to attach to. And there's names for those things. So we're going to run through them now. I'm going to go rather quickly, and then I'll get through it. So the first set of markings or surface markings on the bone are going to be what we call depressions and openings. And they exist for the purpose of things passing through them, like blood vessels or nerves. So I'm going to run through them now, but there's the foramen, the meatus, and the sinus. The first one is called a foramen, and a foramen is very simply an opening. They can be very large or smaller. They're going to allow blood vessels, nerves, and ligaments to pass through. The most common example is the foramen magnum, which is the hole in the base of the skull right here, and that is where the spinal cord comes out. So any opening is called a foramen. And like, for example, here's another example of one, but it's a small one. If you can see, there's a small hole. You probably can't see it for well, but there's a small hole right here. That is a foramen as well. So foramen just means opening. A meatus is a little more involved. It is a tube-like passageway. So it's not just a hole in the bone, it is a tube like a tunnel. And the best example is the external auditory meatus. It's your ear hole. So if I hold the skull up again, you can see there's a hole right there. That is the ear hole. And that is where sound goes in, right? It's that hole in your ear. I have a way to remember that. Hey, meet us at the end of the tunnel after school, and we'll go get some hot dogs and tacos and food, whatever. But meet us, just think of the word meet us at the end of the tunnel, and that is going to be a way to remember that. So it's the tube-like passageway. And then finally, we have the sinuses. And the sinuses are just open cavities within the bone. And we have them in our skull. And again, there's some theories as to why they exist, but the real understanding is they're there for pressure release when it comes to buildup of mucus, because we have sinus pressure, and also decreases the weight of the skull. So foramen are openings. Meatuses are tube-like openings, like a tunnel. And then a sinus is just a cavity or an open space. Okay, the next set of surface markings are going to be processes that form joints. So when two bones come together, they call that an articulation point. And the whole point of bones, well, as we know, there's many purposes of bones, but one of the major purposes of bones is to allow for movement. Muscle attaches to bone, muscle contracts, body moves. And in order for movement to occur, you need a joint. So joints are where two bones come together, and there's three different types of processes that form joints: condyles, heads, and facets. So I'm just going to roll through those real quick. So a condyle is a rounded process for articulation with another bone. So this is a rounded process. The best example of that is what is called the mandibular condyle. So this is your mandible bone. Your mouth opens and closes, right? So real quick, just do this. All right? You can open and close your mouth. And the reason why you're able to do that, if you feel right here by your ear and you open and close your mouth, you can feel it kind of pop out of place. And what you're feeling there is you're feeling this joint right here, which is called the TMJ joint, the temporal mandibular joint. This is the temporal bone, this is the mandible. And the reason why you're able to do that is because this bone has a rounded process. So if I hold up this bone to the camera, you can see that this is rounded. And that is called a condyle. And what it does is it allows that jaw to open and close. If it was not rounded, it would be very painful every time you open and closed your mouth. So that is called a condyle. The next process is called a head. All right, and the head is just an enlargement at the end of the bone. The most common example that you probably would think of would be the femur. It's this rounded head here. There's also one in the humerus, which is your arm bone. And what that does is it allows for rotation, right? So I'm able to do this because of the head of my humerus is rounded like the head of my femur, and it allows for rotation. So it's enlargement at the end of the bone, and that exists in those two places, the femur and also in the humerus. So the difference between the head and like another process is that it's at the end of the bone and it is rounded. And then finally, of these, we have what is called a facet. And a facet is a flat surface. That's how you can remember it. Facet is flat. And a flat surface where two bones articulate. Here's the thing about your vertebrae, right? So I have a spine right here. I have our vertebral column. And the vertebral column is made up of individual bones that are stacked on top of each other. Each one of these vertebrae are a separate bone. But we need somehow to keep this thing all as one piece or it would fall apart, right? And the way we do that is where these two bones come together, there are two flat surfaces which are called facets. So if you look at this diagram here, you can see it a little better than probably what I just showed you. But where these two vertebrae come together, you get two flat facets, and that allows your vertebrae to stack on top of each other and stay as one unit. So what you're seeing here is this is somebody getting probably a cortisone shot into there. This is somebody that probably deals with serious back pain. And this will help alleviate that pain by decreasing inflammation. But what you're seeing here is just what the two facets are, where those bones stack together. Okay, let's finish up here and move through the next couple. All right, these next are surface markings on the bones that allow for connective tissue to attach. So we're not forming a joint here. This is where muscles and ligaments attach. And there's a handful. So let me run through those quickly and then we will be finished. All right, the first one is called a tuberosity. And a tuberosity is what they consider a knob-like process. Now, these are where the terms start to get a little bit, for me, it's hard to distinguish between them. So I'm not going to focus a lot on this, but I just want to at least want you to become familiar with the terms. So the best example of this is the ischial tuberosity. So right now you're all sitting down, right? And you're sitting on a bone. That is the butt bone, but it's actually called your ischial bone. So this is going to be your pelvic bone. It's got three parts: the ilium, the ischium, and the pubic bone. And we're going to learn all about that later on. But the ischium is the part of the bone, like if someone has a bony butt, that is what you're talking about right here. And this end of it, this enlarged part at the bottom, is called the ischial tuberosity. So is it a knob-like process? Yeah, kind of like a knob, but it's just a larger process on the bone that is going to be kind of flattened and knob-like. And that makes sense because there's some surface area there. You got to be able to sit on that. The next one is called a spine. So when you think of a spine, you probably think of something thin, like the spine of a book, and that's a good way to think about it. And the best example of that is your scapula. So this is your shoulder blade. Real quick, everyone, just take your hand and cross it to your other shoulder and feel for your shoulder blade. And what you should feel is there's a thin ridge of a bone there. You can actually walk it all the way up to the top of your shoulder. What you're feeling there is the spine of the scapula. So if this was your back here, this would be the spine of the scapula right here. That's what you were just feeling. So for example, this would be the middle of your back. This would be the middle of your back here, and you would follow, sorry, it's hard to do this from this angle. This would be the middle of your back here, and you would follow that spine all the way up to the edge of your shoulder. So that's called a spine, and that is a ridge-like projection. So that muscle would attach to that, and that's what allows you to raise and lower your shoulders, because when the muscle attaches to this, it pulls the bone up and down. Okay, let's keep going here. A trochanter. So now we're getting into some terms that, to be honest with you, it's hard to distinguish between them. If you were to ask me what's the difference between a trochanter and, for example, a tuberosity, I'd have a hard time really explaining it, and that's why I don't focus on this too much. But a trochanter is a very large process. So this is the trochanter. It's called the greater trochanter of the femur. If you take your hand and put it flat on the side of your hip right now and move your leg up and down, you will feel there's a bone there right on the side of your hip. That is what you're feeling right here. That is the trochanter of the femur. And you can see it in this x-ray. It's this bone right here. And that is there for muscle attachment. It's large. The bigger the process, the bigger the muscle attaches to it, which makes sense, right? If you have a large muscle, it needs to grab onto something to be able to pull. So this is called a trochanter, and that is where your larger leg muscles are going to attach to let you move your legs up and down. A crest, what is the difference between a crest and a spine? Well, a crest is going to have a slight flattened edge to it. So it's a ridge-like projection. Well, so is a spine, right? The distinguishing factor between those is the spine is going to be very thin. So that's going to be that spine of the scapula. And now the crest of this is called the iliac crest. So we're back to the pubic bone again. That was that ischial tuberosity down here. On the top side, we have a thin kind of edge here that is called the crest of a bone. So this would be the iliac crest. So that's right here in your hip bone. That is what your abdominal muscle is attached to. So this, you can see here, is the iliac crest, this flattened surface. Think of the crest of a wave. So as a wave crests, that's where it curves over. And this is where your oblique muscle. So if you've ever done a side crunch before, this is where those muscles attach to. And a process is just a prominent projection on the bone. And the best example of that are going to be your spinous processes. And those are at the, coming off of the back of your spine. If you've ever seen anybody bend over before, you know that they have those projections on the back. Anything sticking off of a bone is called a process. So all those other examples I just gave you, trochanters, tuberosities, those are kinds of processes. But a process is just something that sticks off the bone. And a process always has the same job. It's there for muscle attachment. So your muscles need to attach to something. We have a lot of processes in our vertebrae. And the reason why our vertebrae are so weird looking is because our back has many small muscles which attach to it so that way we can move. Think about how your body works, right? Your arms and legs can move, but your spine, we can twist, we can turn. We have so much more flexibility at our spine. And the reason why we do is because our spine is made up of many small bones with many processes and many small muscles attaching to them. So a process is just any projection on a bone that is coming off of it. And then finally, we have a suture. And a suture is just where two bones meet together. So at one point, they were separate, and then they fused together. And the best example are the sutures of the skull. So at one point, these were individual bones, and during development, they fused together into one bone. And they leave behind these little cracks called sutures. And those are where those little extra bones are that I mentioned earlier in this lecture. Sometimes you get these little extra sesamoid bones that might be embedded in these cracks. And that is it.